Welcome back to Men's World Today. So today we're talking about the common ailments that men face, particularly after the age of 40. We are fortunate enough to have Dr. Nadia here with us today. Today we're going to be talking about prostate cancer. Now, Dr. Nadia has been a GP for the past 20 years. She also specializes in aesthetic health. So, Dr. Nadia, thank you very much for honoring us with your presence today.
Thank you for having me.
Thank you. As we spoke earlier, there are a number of ailments that men particularly face, and especially when they hit the age of 40. And more importantly, we have issues approaching the doctor quite early, so any diagnosis can be done early on rather than leaving things to the very end. So today we're going to be focusing on prostate cancer. Just tell us a little bit about where you practice in terms of your GP, and I'm sure I said 20 years, right?
So yes, I have been a practicing NHS GP and also do private GP work as well. And like you said earlier, I'm an aesthetics doctor too.
Thank you very much.
You're welcome.
So, just giving you a little bit of background of prostate cancer. Prostate cancer affects 1 in 8 men, and I think it's 1 in 4 black or Asian men. So it's quite a serious condition, but if you catch it early, it's absolutely treatable. Dr. Nadia, what are the early warning signs of prostate cancer?
It depends. So when you say prostate cancer, and including, say, prostate health in general,
right? Okay.
It could be different things. So for example, prostate cancer mostly is asymptomatic, which means most of the time there's no symptoms.
Right.
So things to look for are unexplained. It's very important. Unexplained, lower back pain, for example, or bone pain, erectile dysfunction is another very common sign or symptom to look for. Lethargy, those unexplained symptoms that men might experience could indicate there might be something wrong with the prostate. And of course, there's other things when we say prostate health. So, for example, they can have a benign prostatic hypertrophy, which means an enlarged prostate.
Right. Okay.
It doesn't mean they've got prostate cancer, but they will have symptoms such as problems voiding, or which means, say, for example, if they're straining to push out the urine.
Right. Okay.
Or if there's a difficulty with the flow, or a change in the flow.
Right.
Say, for example, it's spraying, or it's spitting, or it's less to pass your urine quite frequently in the day or at the night. That can also indicate there might be something wrong with the prostate. So those different symptoms, those things you need to look forward to, men need to look for, I would say go and see your GP. It could mean it is something benign, i.e. it's nothing to do with cancer, or it could mean there is something cancerous. So earlier, like you said, the earlier the better.
Yeah, it's quite interesting actually, because I wouldn't necessarily have associated lower back problems and, things like, erectile dysfunction, because I do know for a fact that some men put that down to stress and mental health issues and things like that. But I guess a combination of these things, when you start demonstrating, then you have to start...
Exactly. So, for example, another cause of erectile dysfunction, like you said, could be stress.
Yeah.
It could also be diabetes.
Yes, that's right.
Lower back, usually the reason why that is a symptom or a sign is because if the prostate cancer has gone too far, then it spreads to the bone. And the bone nearest in that region of the prostate is the lower back.
Okay.
So usually it's the pelvis or the lower back, the spine. That would be the first place where we say it would spread, what we call metastatic.
Guys, there's a lot of technical words being spoken right now, but unfortunately that's that has to happen. But feel free to watch the video back. My next question is, why is it so important? The obvious thing will be sexual performance, I guess, but I'm sure it's connected to a lot more things. What other things is it connected to? You said symptoms like lower back pain and difficulty passing urine and things like that, but what are the other effects?
So like risk factors, for example?
Yeah, I guess risk factors,
So like you said, it is actually 1 in 6 to 8 men,
right?
And very correctly you said 1 in 4 black men. Generally that's because it's just genetic.
Right.
It's not like anyone's doing anything more or less than the other.
Right.
It's generally genetic, and the main thing to look for is a family history.
Okay.
So if you have a close relative like your brother or your father, then you are at higher risk.
Right.
Of getting the prostate cancer.
Okay.
So that's always something to look for. Age is one of the risk factors. So it's most commonly diagnosed in men from 65 to 69-year-olds. More than 50% of 70-year-olds or more or older get diagnosed with prostate cancer.
Wow.
But it doesn't necessarily mean you are going to, say, die of prostate cancer.
Yes.
And it also doesn't necessarily mean just because it's 1 in 4 black men that they're more likely to die compared to someone who's, say, white who has been diagnosed with prostate cancer.
Right, okay.
It's just the risk of getting it.
Okay. I mean, you said most men between 65 to 75, but at what age should we...
I would say be more aware.
Right, okay.
So if you start, like everything, everyone who reaches 40, whether you're a man or a woman, you're like, oh no, I reached 40. Everyone should be more aware of their body, whether it's breast cancer, prostate cancer, heart disease, anything like that, even, depression, anxiety. These are things that everyone should be more aware of because you are inevitably getting older.
Yes.
Your body is getting older.
I made a couple of notes there, frequency and 40. So, like, I 2025, 40 is generally perceived as not that old. But the frequency thing is what I want to delve a bit more into. You holding it in and not going as frequent, or is it a case of when you just don't feel like you want to go to,
No, it's more increased frequency. So, for example, if you feel like you're needing to go quite often.
Yes.
And more often than usual.
Right,
so that could happen during the day or during the night.
Right, okay.
And even when you do go, you feel like you haven't emptied the bladder properly.
Right.
And you feel like, oh, wait, I need to go again.
Right, okay.
Also, another important sign is if you see blood in the urine.
Yes, right.
So not everybody's the same.
That's
true.
Which
is the same as, again, with everything, any condition, anything at all. It's a change in your norm. So if you suddenly just see and notice things that aren't the same as it used to be, don't wait. Don't ignore it. Go see a GP. It could be nothing, but it's better to be safe than sorry.
Well, guys, this is another point to take note. We have to be more aware of our body, Now, I've had PSA tests and it's come back as negative, so I've been okay. But is that the only test available?
Yes and no.
Okay.
So with PSA testing, it's prostate-specific antigen. So basically, an antigen is anything that's in your body that causes an immune response. Your body thinks this is not right. I'm going to start building some sort of antibodies, something against it to fight it. So this is specific to a prostate. So for example, it will always be like 0 and negligible, for example, to women because we don't have prostate. Interestingly enough, trans women can still get prostate cancer. It is not, say, removed in the gender-affirming assignment. They also have to be aware that if they get symptoms or signs, that they need to go and get checked as well. So going back to PSA, the reason why we don't have a national screening in the UK, say for example bowel or breast, we do, is because it's not sensitive specific enough, which means if you do a PSA, for example, and good for you, it's come back negative. So some men, it could be called a false negative. So which means it's not really negative, and that could give the wrong result. Equally, it could be a false positive, which means it shows that you might likely have prostate cancer. But again, it's not specific to prostate cancer because men with an enlarged prostate, which is benign, could also have a high PSA. And it also depends on the age. So there's graded on group, which is graded on age group. So it's 0 to 4 is usually considered a normal level. And as you get older, it gets higher and higher. But again, it just depends. There's a sort of classification groups. So you need to look at that. But if someone, say, for example, gets false positive, then they automatically will have to be referred on to get investigations. And these investigations can be quite invasive. So, for example, a biopsy, which means, you get a piece of your prostate cut out, sent off to the lab, and it might turn out that they never had it in the first place. So that's why there isn't this screening of using the PSA tool here in the UK. However, saying that, good news is that there is a trial that hasn't opened up yet, but it's just started in November of last year, called the Transform trial, and Transformation trial rather. Its aim is to come up with the best screening tool to detect prostate cancer as early as possible.
So essentially, at the moment, we just have the PSA test.
Yeah, you're discouraged as doctors to do a PSA test if someone comes in. So, for example, a man comes in and says, I just want to get it done. but say for example there are no risks, like there's no family history or their ethnicity, or they're not getting any symptoms or signs, then it's discouraging, but it's not impossible. So if someone's really worried, you give them all the information about how it can be a false positive or a false negative, and if they're still willing to do that, then of course, you can get it done. Okay. But that's what the trial's about, because they are looking at things like MRIs, the PSA testing as well. Yeah. One of the resources you can look for is like Prostate UK. Other things are like November.
I've done the Prostate UK walk in Battersea Park. I did it last year. I'm actually planning to do it again this year. Actually,
well, this is it. It's awareness, isn't it?
That's right.
Which is why diagnosis of prostate cancer is on the up, because more people are being aware. As well as the more aging population.
In terms of treatment, what are the options of treatment?
If you catch it very early, then there is something like surveillance. That's called active surveillance.
Right, okay.
So they would do the scans that you need to make sure that it's not growing or getting worse. Right, okay. And that goes all the way to something called radical treatment, which is taking the prostate out. Radiotherapy, chemotherapy, hormone therapy, because it is derived by the hormone or pushed by the hormones. And so you would stop the hormones like testosterone being produced that would feed into the prostate cancer.
I guess for men, if we stop producing hormones, the side effects could be quite...
Which is why you can get things like the erectile dysfunction as well.
Right,
which is another side effect, an adverse effect of the treatment. Well,
guys, vigilance is the key word here. Is there any specific dietary requirements men can stick to that can help too?
It depends on what you read. Again, a healthy diet, a healthy balanced diet is good for everybody, and it's good to prevent any sort of disease. Right. But they do say certain vitamins and minerals, supplements, like things like carotenoids, which are like yellow, orange fruits and vegetables.
Right, okay.
Things lycopenes, which are like tomatoes, and interesting. Cooked tomatoes are better than raw tomatoes, that sort of thing. From
a GP's perspective, what other reasons are there to encourage men to talk about these things openly and early?
A public health campaign raised the awareness. So I guess that's what November is trying to do. Yeah, I guess
that's what it's about.
But I always say, any problems, anything at all, go see your GP. That's why we're here.
Yeah.
We're not here to just, treat and try and solve problems and your health ailments, but to educate as well.
Well, Dr. Nadia, thank you so much for your time.
Thank you for having me.
Guys, thank you for watching this. And as you know, at Men's World, we're all about encouraging a holistic, healthy lifestyle for men. If you like this, share it. And until next time, have a nice day.